welcome to this session about the Certificates Processing System, or CPS. So my name is Valeria Martarelli. I'm one of the change managers here at EMA, and I just wanted to introduce the session. Please note this is being recorded so that you will find the recording on the events webpage. You'll be able to consult it at a later date. As you will have seen, this is the first of 3 demos. So in the next 2, we will do a very similar thing. So we will, please use your judgment as to whether you need to attend all 3 of them. Obviously, if there are any developments that we need to showcase, we will do that in the next 2 upcoming demos. So without further ado, I will leave it to my colleague Anna that will start with the CPS demo. And then my colleague Paula will take you through some tips from the accounting team. And then we will go through your questions. You should have the link to Slido and the code that you received via email. So please use that to send questions throughout the presentation, and then we will take them at the end. Anna, over to you.
Thank you, Valeria. Good afternoon, everyone. My name is Ana Fernandez, and I am a Certificates Administrator in the Procedures Office. Today, I will guide you step by step through the process of how to complete the online form for requesting certificates of medicinal products using the Certificates Processing System. The system went live on the 6th of January this year, and it has replaced the former one. Certificates can be ordered by marketing authorization holders themselves or by requesting companies on behalf of the marketing authorization holder. The documents published on the Certificates of Medicinal Products website have been updated accordingly to reflect these changes. All the necessary instructions regarding how to register and how to gain access to the new system can be found there, including a video tutorial on how to use the Certificates Processing System. In order to access the CPS application, you first need to have an active EMA user account, which you can create by registering in the EMA's account management portal. Once registered, you can request the affiliation to the organization holding the marketing authorization of the medicinal product and also the appropriate user access role. Use your EMA account credentials to log into the application. After you have successfully passed the signing step, you will be prompted to fill in the customer account number, also known as the SAP number or SAP ID. It is important to notice that the customer account number used must belong to the marketing authorization holder of the medicinal products requested. Entering a different customer account number will result in your application being rejected. Once login is successful, we can start filling in the form. Please note that the fields with an asterisk are mandatory. In the company information section, type the name of the marketing authorization holder. Provide the full address of the company. Enter the postcode, and from the drop-down menu, select the country. Now, fill in the contact person details, the title, the first name, the last name, the telephone details, and for this field, please note that the country code needs to be added as well, for instance, +31. Next, fill in the contact email. And note that this is the email address that will be used for all the correspondence, also for sending the certificates. If you are a requesting company, that your name and your address is different from the MAH's, and you are ordering certificates on behalf of the MAH, tick the box, "Are you a requesting company?" and then fill in the company's details. Only tick the box labeled "Certify Requesting Company" if you would like to have the requesting company mentioned in the certificate itself. Click Continue and select here whether the application has been submitted via the centralized procedure or under Article 58 regulation. Then confirm the GMP compliance status and indicate if the products are free from reported hazards. Click on Continue, and in the Product Information section, first enter the trade name of the medicinal product. Then enter the pharmaceutical form, for example, capsule. Fill in the trade name in the importing country only if applicable. The purpose of the trade name in the importing country is for the applicant to be able to communicate the intention of a different name from the centrally authorized one. If the product is authorized under Article 58 regulation, please also tick in this box. Next, add the details about the manufacturing site. Type the name of the site. Provide the full address. And then select the activities performed at this site. Please make sure that you have selected at least one activity. It's only mandatory to include at least one manufacturer of the wool finish product. If you are in need of adding more sites, please click on the Add a New Site button and repeat the process. You can always delete the last added site. Now let's move to the certificate information. Select the importing country, for example, Venezuela. Enter the marketing authorization number of the product. This field represents one certificate, and within each certificate, we can only issue either for single presentations or full pharmaceutical form. Select the EU languages that are applicable, for instance, English and Spanish. Specify which annexes are needed in addition to the SPC. If you select None, only the SPC will be attached to the certificate. Choose Yes or No for product availability on the EU market. If you would like to add more than one certificate, please click on Add a New Certificate. If you're applying for more than one product, add a new product. Note, however, that you can only apply for several products as long as they belong to the same MAH. In the Additional Documents section, you can upload any supporting documents in the formats PDF and Docs. Click on Choose Files button, select the documents in the browser, and upload them. For multiple upload, it is needed to select the documents in one go. in your message section, add any additional comments that you may have. For example, if the annexes you would like to have are for full SPC or for a specific presentation as a relevant example. Click on Continue, and at the top of the screen, you will see the customer number that you used for signing in, which is populated automatically. Next, choose the priority of your request, either urgent or standard. In the number of the certificates field, you will see how many certificates you are requesting. The request fee is related to the number of certificates and the urgency of your request, and it will be populated automatically. If the MAH has a valid SME status, the fee displayed will not be applicable. It is possible to add a purchase order number or reference that will be included in the invoice. This field has a limit of a maximum 35 characters. Once all the fields are filled out, double-check your information to ensure accuracy. When you are ready, confirm by clicking the checkbox. Finally, click on the Submit Your Request button to submit the form. The option to download the form as a document is currently being developed, and we hope to implement it soon. However, we do not have a date as yet. You've successfully submitted the form. Now wait for the submission acknowledgement email that will arrive shortly. After that, you will get a notification informing that the invoice has been created. The invoice will be sent to the customer of the organization on behalf of which you have logged into the CPS web application. Once the invoice is paid, you will receive a confirmation email with the unique request number. The processing of the application begins the next working day after the payment has been confirmed by the agency's finance department. Thank you for your attention.
Great, thanks so much, Anna. So shall we just go quickly onto some financial aspects now? So over to Paola.
Thank you very much, Valeria, and good morning, everyone. I am Paola Samassa. I am the accounting officer of the agency, and with me today is also Alina Cecesco-Gigina, who is the accounts receivable team leader. What I'm going to present today are key takeaways regarding the process of receiving an invoice and paying an invoice, which are going to be presented on screen now. So regarding the receiving an invoice, picking up from what was just said from Anna, upon submission of a certificates request, the invoice is issued to the marketing authorization holder, the products the certificates request relates to. So this is really the customer account number, or also known as sub ID, that is entered at the beginning of the process. That is where the invoice is issued. And on the basis of the queries we have received, we appreciate that this is, there is a slight change from the way the process was working before. And obviously we remain available to clarify these questions. Yeah. The invoice is then issued, as I said, to the marketing authorization holder, and it is sent to the marketing authorization holder designated financial contact points. This is a directory that we have already in place for all the other procedures. So in this respect, nothing has changed here. However, we also received questions why the invoice is sent not together with the confirmation that an invoice is issued to the certificates requester. This is because the invoice is issued from a different database, is issued from the EMA financial databases, and is sent as usual to the financial contact point. In parallel, as it was also explained a moment ago, a notification that an invoice has been issued is also sent to the requester of the certificate, which may or may not be the same. I believe in most of the cases is different. Then the invoice, as always, has a deadline for payment. This is clearly indicated on the invoice under the payable by header, and it is 30 days from the date of the invoice, 30 calendar days. So this is the deadline for the payment. In case of no payments being received within this time frame, the 30 days, then EMA will issue an invoice cancellation because of the expiry of the invoice and because we will understand that there is no intention to proceed with the request. This cancellation is sent after day 30, and after that the submission request is considered cancelled. With respect to paying an invoice, thank you, Valeria. I would like also to reiterate that payment of certificates should only be made after having received an invoice, and in a moment we will know why. So even though the process is called prepayment, we understand it might be misleading. It doesn't mean that you have to make the payment the moment when you submit, but you have to make the payment the moment when an invoice is received. Why this? Because we will need the invoice number to be quoted in the bank transfer or to be quoted in a remittance advice, as we are going to see in a moment in the next couple of bullet points. Yeah, we always said that we prefer to receive one payment per invoice. We understand that with certificates, of course, we are talking about high volume, low values. Therefore, we also allow for multiple invoices to be paid together in one bank transfer. Where possible, all the invoices that are paid should be quoted in the bank transfer in the reference fields. And if this is not possible, then we are asking companies to send us a remittance advice with a breakdown of the invoices that are paid. And this should be sent the moment when the bank transfer is done, and at the same time or before we receive the payment in the bank, because that will help us to allocate then manually the invoices. So one way or another, either quoted in the bank transfer itself, which will allocate an achieve an automatic allocation, or quoted in a remittance advice, still we will need always to know the breakdown. The remittance advice should be sent to the accounts receivable email address, which is already well known, but it is also, we will put it in, you also find it in our guidance and in the website. Or if you don't know it, we'll put it in Slido if there are questions in this respect. So why I said that is important to quote the invoice number in the bank reference, because by quoting this will facilitate the success of automatic allocations. The automatic allocation means when we match the invoice number with the payment. Therefore, then a successful message is sent to the CPS system to process the application. Once we receive the payment and we successfully allocate, as was said earlier by Anna, a notification of invoice paid is then sent to the requester, and then the handling processing time according to the timing that Anna explained starts. So we talk about successful allocations. Normally, and this is the last, yes, before we talk about the failures, I also wanted to say that we allocate all the payments received in any given day immediately the morning after. So why do we need this timing? Because it is our bank that will only provide EMA with an electronic bank statement with all the payments received the day before, the moment when they clear their operations. So that is happening at midnight of the day before, and then in the morning after at 7 a.m. we start with the automatic allocations of everything. As I said, let me just reiterate, if there is a clear reference, the allocation happens immediately. If the reference is slightly unclear, and this is the handling the exception, then the accounts receivable team, Alina, and the team will manually look at the remittance advice and process an automatic allocations. So this happens in a couple of hours the morning after. When we have issues in knowing which invoice you intended to pay, that is the moment when we immediately contact you and we ask you to confirm for us what are the invoices that you intend to pay. We appreciate that there are many invoices and also all of the same amounts, but obviously we want to avoid delays and we want to avoid things remaining on hold. So you will receive immediately from us an email requesting you to either provide us with a remittance advice or to confirm by email how we should allocate the payments that we have received. Obviously, this is a manual intervention. These are obviously exceptional cases. It happens sometimes. So I again reiterate and ask for cooperation to send us the remittance advice so that we can kind of resolve all these exceptions before by knowing exactly what the payment was intended for. Obviously, if we have to request you to send additional information, we will have to wait for you to come back to us, and therefore the message to the CPS system of successful allocation will be put on hold until we know from you what is it that you intended to pay. Some cases are straightforward, other cases requires us to contact you because obviously we want to do the correct allocations. Yeah. So this is really what I wanted to say, and maybe I add also one thing that perhaps if you can go, Valeria, to the previous slide, which is really the content of the presentation for today, if you still have it. Yes. So we have on our website in the How to Pay page a guidance that will explain in details what I have verbally explained here very briefly. And I invite everyone to consult it, especially before asking maybe a question. Answer should be there. If answers are not there, it's also very useful that you tell us so that we can improve on the basis of the real cases and the scenarios and your experience as well. So thank you very much again, and we are open for questions.
Great, thanks a lot. Paola, okay, so let's go into the questions quickly. I see that the first one is, could you confirm if EMA plans to enhance the portal's functionality? So on this one, I think we all agree, we can say that we are taking all of your, let's say, requests and suggestions into consideration. At the moment, there's no clear timeline that we can confirm and stick to in terms of enhancements. So that's the answer to that. Now, in terms of whether is there a way to save some details, again, perhaps we will be able to show you a bit more in the next demos, but for now, unfortunately, we cannot confirm a timeline for these improvements to be, let's say, put in the system. Now, does the invoice paid email from EMA indicate the start of assessment of request? And if so, what is the usual expected time? So maybe Paola or Alina, you want to go through this one, which I think you just covered, Paola, but maybe we can reiterate the answer to this.
Well, the invoice paid, I think this was covered by Anna earlier. So the invoice paid means that we have allocated the payment to the invoice and that the message has been released to the certificate team for the start of the processing of the certificate. So what is the usual expected time to receive this email? After okay, we have to now clarify here what it means completed the payment. So the moment when you send the payment to us is not the moment when we received it. Normally, it takes 24 hours for a SEPA payment to be received, from the moment you send it to the moment it's in our bank account. And as I said, after it is received in the EMA bank account, then the morning after we are able to allocate it, and then the message is passed to the certificates system, and then the handling will start according to the operational targeting times in force. Yeah, so as per guidance. So I think I reply the question, maybe adding other elements, but I think there are other questions along these lines later coming up, so it might be useful.
Okay. Thanks, Paola. Okay, so in terms of previously, we could submit a permission letter from the MAH giving permission for a third party to apply for a CPP, and now this letter is not needed. So how would the third party apply on the CPS system? Maybe that one is for Virginia.
Well, yeah, I can answer. So there are lots of instructions in our website on how to apply for a user ID. So basically, the permission letter has now been replaced by the user ID. So the third-party company needs to discuss with the MAH for the products, and it's the MAH the ones that give access to a particular user from the third party to do the login from their behalf. So the important thing is that the login always needs to be done with the MAH user ID of the product you're requesting the certificate for, because then, as Paola also explained, that will give you the customer number and the correct invoice will be managed. But please check the website because you have there step-by-step instructions on how to apply.
Absolutely, thanks, Virginia. So that's the Certificates of Medicinal Products webpage on EMA's website. Okay, so moving on to the next one, maybe again, that's for Virginia. So what happens if somebody submits a request, but then they realize that there is a mistake in the form?
So one of the things that you can do is not paying the invoice because once you click the submit button, there is no way you can amend the application because the submission has already been sent. So you need to be very careful and checking everything before clicking the submit. But if you've clicked the submit button, then you have 30 days to pay the invoice. Don't pay it if you think that is not the right submission. You can apply again to fill another submission, the correct one, and then you ensure that that's the one you pay. So if you don't pay the invoice, we're not going to process.
Great. So just leave as is. Okay. And then after the first launch of a drug, how fast can we issue CPPs? Again, I think, Virginia.
Yes, so it can be immediately. So the process is that once a company launches the drug, the first launch, they need to go into our website in the IRIS, EMA IRIS site. There is there to report the marketing status. So they can report immediately the marketing status of the product. And then on the same day, they can do the submission for a certificate indicating in the application form that is marketed. So we don't require any additional proof. So everything can be done on the same day. There is no need for wait if the company wants to do it quickly.
Great, thank you. Okay, so is it possible to request a certificate without affiliation to the MAH like in the US?
No, it's not possible because the certificates, European certificates contain some information that is not publicly available, is considered confidential. Some of them contain the exact qualitative and quantitative composition. They contain lists of manufacturers that are not published anywhere. So we cannot disclose that type of information without the MAH knowledge. So only MAHs or a company acting on their behalf can request a CPP.
Right. Okay. So just conscious of time, let's see, maybe we take another 2 questions and then respond in writing because I see there are some more coming through. So how do we request to address the invoice to the requesting company and not the MAH?
I can take very briefly this one, and we do have in place, as is also described in the guidance, the system of billing address. However, I have to make a clarification here that if we decide to implement a billing address which will appear on the invoice along the marketing authorization holder address, this billing address will apply across all the procedures and the fees. We cannot have a billing address specifically just for the certificates request. So this is as far as I can reply to this answer. which is yes, but not exclusively for the certificates. Yeah, so it is possible, but then it would apply to all procedures requested by the marketing authorization holder.
Clear? Okay, so let's do the last question, and then the others we will do a Q&A document that you will find on the events webpage. So can a third party use the MAH's customer account number and details to log into CPS?
Well, yeah,
Okay.
it's linked to the first question that I replied, that yes, they have to have a permission from the MEH. The MEH needs to give them, access to the user ID. And then, of course, because they are entering the system on behalf of the MEH, they will have the MEH customer account number for the dialing in.
Thank you, Virginia. And let's just take this one because I see that there are more of questions like this on timelines. So can you just clarify what the timelines for urgent and standard requests are?
So processing timelines is 2 days for urgent, and we always aim for 10 days for standard requests. That's the average processing times.
Okay, so yes, I believe we need to close the meeting as we're out of time, but please remember, so we have another 2 sessions where perhaps we'll be a bit quicker in showing the system and a bit quicker in the first part, and then we will use them as Q&A sessions. So if you want to attend those, you should have the invitation. But for now, thank you very much for your questions and for being with us today. And as we said, the recording and the Q&As will be on the events webpage. Thank you very much.